Hi everyone, welcome again to Patient Sports Services Africa with Ms. Irene Ogong'o and me, Jenna of Galactic Productions. To be talking about something that's really important in our current in our school health system and how our children are affected when we are not actually there to speak for them. You know?
Yeah.
Someone is ill at school.
Yeah. So as Sharon has said, definitely that's what we need to speak about. And now because of COVID, and then we have some kids who've gone back to school, and then there's all these issues of who is, COVID positive, who is not, how it's being handled. And fast forward, January is around the corner. And I don't know how many people are having conversations with the schools that their children go to, who are minors, about what they will do in the event that there's, a COVID case and what happens to the ones who are there and all that. That's why we need to talk about it.
Because it's the suspected cases that are even worse, because these things are leaving our children traumatized.
Mm-hmm. Yes. Yeah, so, and my son was one of them who went through all that, and I was like, okay, there's need for some education around it. Because, for the kids, I'm not sure how much they understand about COVID, and I'm not sure how much the school is helping in the process of them understanding what COVID is, what it means to be a suspect, what the procedure is if you're suspected, and then how to reintegrate them back into class, even if they have to be isolated for some time and then come back, because you're just thrown in the middle of everything and you have to survive, and that contributes to mental health issues.
Yes, because like in your case, can you just like what happened in your case, so that we can take that almost like our case study for today?
Yeah, sure. So he went to school, and then, they have this thermometer that they use to check temperature.
Yes.
And they checked his temperature the first time, and it was high, 38 point something.
Yes.
And then immediately they took him, put him in an isolation room for more than 2 hours. At one point, someone came and took my number from him and said they're going to call me. Nobody called me. And then they went back and said, okay, let's check your temperature again. And, if it's still high, then we see what to do. They checked it again. It was not high, it was low. Meanwhile, they had not done anything for him. Yes. And they took him back to class.
Yes.
And that day they were having exams, and the exam had already started, and he had to go sit for the exam and finish at the same time with the rest of the people.
Wow.
And, the whole day now he became, the suspect. So everybody's like, okay, don't come near me. And, he came home. I know. And so on Monday, it was difficult to say, okay, go to school. It's like, those people there, they were not nice. And everybody was like, okay, you have COVID. Your fever you had a fever and all that. Yeah. And that was traumatizing for him and for me as a parent, because nobody called me. The school did not officially communicate to me about that. And they isolated my child and did all this, their first aid, whatever they call it. Okay, they didn't give him any medication, just to check his temperature and then isolate him. And nobody counseled him. Nobody told him anything about, so what's the way forward? And he's the one who came to tell me the story. And, that made me think, how many more students are going through that? And what are parents doing about it?
Yes. And for me, the biggest thing, because your son is only 12, isn't he?
Yeah, 14.
Oh, he's 14. So at 14, 12, 13, 14, 15, 16, our children are already going through a lot of playground politics.
Yes.
So already there's a lot of confusion about life, about finding out about themselves and all of this. Yes. And as you say, where there's no guidance, there's a lot of confusion, so there's a lot of stigma. You know?
Yes.
It would have really made me sad as a parent, and it's not the left to do me. So I think I'm angry,
Yes.
you know, as a parent, to know that the school, A, isolated my child for a couple of hours without telling my child why they were isolated, for how long they were going to be isolated, whether we were going to call your parents or not, because this child is sitting there thinking they've asked me for my mom's number. My mom must be on her way to sort this out, because they know that's our responsibility to sort it out.
Yes.
And so they wait. And they wait. And my mom doesn't come. The adult in my life doesn't come. And these people have locked me in a room without telling me anything, and for the rest of the day, everyone is looking at me like a leper. Everyone is treating me like a leper. You know? So,
yeah.
And at least in this case, the temperature didn't stay high for them to take the next course of action, which would have been what? Do you know?
So, I mean, as a parent, you know, when you get to that point, you even lose sight of all these things. And every school will have a different course of action. Yes. All I'm saying is whatever their course of action is, they need to let the parents know. But the only way that will happen is if parents now take a proactive role and really just go to the school and find out, okay, you want my child to come back in January. What do you have in place?
Yes.
So if you know, when they come, what happens? Oh, they will wash their hands here, we'll check their temperatures, or our thermometers will be serviced every 2 hours or something, or change them because they could be faulty. If they are suspected of something, they will be isolated in this room, which I now know what the room looks like, what's in that room. And when they're isolated, what happens? Will you call me? Or is there some hours that we wait for before you call? What happens in that process? If they have to be taken to hospital, what is that process? Is it the hospital that I normally take my child to? Is it the one next to you? Where? And all those things we don't have. And we're just talking about not after school fees. Yes, school fees is important. But as Magoha and whoever else said, a child is only as good as when they're alive. If you look for school fees and then they go there and they contract COVID and then there's no system in place, that's a big risk.
Yes. And now with COVID, we have to realize that some of the symptoms could be TB, could be meningitis. And you know that sitting someone in a room, if say for example they had meningitis, and checking their temperature not every 15 minutes like they would in a hospital, but after 2 hours, it's a bit. And we know things like meningitis, and I know this is worst case scenario, but we have to think, yes? Nimezaa mtoto. Now, mine was nearly 5 kilos. I don't want to think about it. Anyway, so all that, I've raised this child because mine is 15 now. I've raised this child to 15 years. It's hard work.
It is.
Yes. All I needed to know, and especially in these times of uncertainty in our health system, all I needed to know is what happens if my child falls ill. How often does the school ask you for an up-to-date contact number? Not just for yourself, but for a family member. Because these are things that as parents, we need to ask ourselves. How well is the school equipped to take care of my child in case of an emergency? Which hospital do they normally take children to? So that when the school calls me, yes, I'm not rushing to my hospital where I think my child will be. I know already where I'm heading towards.
Yeah.
And I know the procedure. I know who's going to take it. Is it the school nurse? And in the absence of a school nurse, is it someone else? You know, if my child has is of a certain religion, yes, am I entitled to say that, does the school have, say, for example, a female chaperone at all times that can chaperone my female child, or a male chaperone that can chaperone my male child into a hospital and take care of them should they need to be undressed? What is the safeguarding policy of this school?
You know, you said something that's interesting. You said school nurse. And, you know, at this point is the point I say, how many people, for the ones whose kids go to, whether it's private or public or whatever, how many schools have a school nurse?
Not many.
And I can bet you most of them have a school secretary who doubles up as a nurse, and she just gives out paracetamol and whatever else. They don't have a school nurse. So that becomes a problem, number one. And then number two, in this COVID era, yes, there's that nice hospital I like taking my child to. Mina Ndanga Nairobi Hospital. I know there are people who will say that. But if it's an emergency, let's take a step back. Imagine if they've run out of oxygen, you know? And it doesn't make sense for me to be moving, for example, from Eastlands and trying to take your child to Nairobi Hospital when they could have been taken to the nearest facility. But these are the questions that we need to be asking in the school. In the event of an emergency, what is the referral system in place in that school? Yes, there's the whatever hospital I like going to, but that does not work when there's an emergency. When there's an emergency, there is need to stabilize someone. There's need to preserve life. Where does the school take these kids when there's an emergency? That's something we all need to know. Is there an ambulance in place? Or is that the time they start calling, I don't know which rescue people to come and try? All these things, they need to be in place. They don't need to physically have an ambulance, but they need to know that this is the ambulance number that we will call, so that everybody knows, so that even when they call me as a parent, I know. They say, oh, your child is sick and we are taking him to the nearest center, wherever, for first aid. I know where the facility is. I know the means of transport they are using, because I don't want to imagine that they're going to be suffocating someone's child in a school bus trying to get to wherever. All these things, they make a lot of sense. And every school must have the basic equipment to check basic things, thermometer, a pulse oximeter. It's a very simple gadget where they used to check oxygen levels and pulse rate, because all these things then determine whether it's an emergency or not. But if all we are doing is checking temperature and saying, oh, ukona fever, and then it's like isolation, that it's on its own does not really help.
Exactly. And the thing is, once you isolated, okay, so kids are going to school in buses. At the moment, the school buses are not so stuffy because there's fewer kids in the school, so there's social distancing. We all know that our school buses are being overcrowded worse than some of our countries out here. Because some of our countries are afraid of police. But some of our children are being herded into school buses like cattle. And we agree to it. Your child is supposed to sit on a seat with a seatbelt for safety. But you see your child coming into a bus that is already full. Anyway, my point is, this child gets into this bus, is standing the whole way, maybe akatoka Eastlands at a group of schools. Before you know, and they sweat, temperature temporarily. Now, we have 5 children who have arrived at the school with high temperature. What are we doing? What is our protocol? what vile tumesema, there are simple gadgets out here that can help us. Because what we also have to remember is, even for us as adults, if we find an emergency, we have to start knowing how you found the person, number one.
Yes.
Ask them name, ask them a contact number while they're still compos mentis, while they're still able to speak to you. Ask them where they come from. Ask questions that can lead you to get next of kin while this person is still speaking. Now, then ask them, how are you feeling? You have a headache. Does your neck hurt? And this is why it's so important for every single person in our society to have first aid knowledge.
Exactly.
In a country where almost 4,000 people recorded deaths on the roads, 4,000 people per year, 40,000 people every 10 years.
Mm-hmm.
Let it sink. In a country where the roads are killing faster than even diabetes, high blood pressure, which are lifestyle related nowadays. Yes?
Mm-hmm.
However, most of us don't even know how to check vital statistics when they find someone in a road accident.
I know.
They are not breathing.
Yeah, as simple as check their pulse rate.
They don't know where to put their fingers. You know what I mean? So, this is my point is, in a school where the security guard checks your pulse, tells you, now you've got 5 children isolated together. One of them might be contagious.
Yes.
Now, these children, they don't need to be isolated for so long before someone comes and checks. 15 minutes, temperature kama ilikuwa artificially ishateremka. Hata na 5 minutes. So, in most cases,
yeah.
15 minutes later, the temperature is back up. So,
yeah.
We have a situation where you've kept these children in the same room for a whole hour without checking every 10 to 15 minutes. So as parents, we need to ask ourselves, that protocol, does it make sense? Once you're given a protocol, don't just accept it because these people are not medically trained.
I mean, and now the schools are closing, or even, well, those who've been doing online classes, the schools are closing for December holidays. And I'm yet to see any circular, well, maybe for my school, maybe the other schools have it, I don't know. But it would have made sense right now to be having meetings where you have some parents involved in whatever the protocol will be for the healthcare system. Because now more than ever, we have to agree that every school needs a healthcare system in place. And not just because of COVID, but just moving forward. And every parent must have it at their fingertips. Every child must have it at their fingertips so that it's not being done just because somebody else said it. Yeah, so I really don't know. So what I wanted to do is probably give a few, like 5 tips that, you know, we can use as we move forward with this issue, so that maybe by the time it's January, as we go to take our kids, we already have some, we're empowered somehow around how to handle the healthcare system in school.
And can I just ask something? A business idea for an insurance out there, which would really help. I feel like schools, when children come to the school, should have some form of insurance, health insurance, which parents can opt into. Effective, cost-effective medical insurance, ile initial. Do you see what I mean? If your child is ill, they take him to hospital, they're covered up to 10K. At which point, by that time, you can either transfer them or continue with your own insurance. But while the child is in school, they're covered by these guys. we control that cover, which means we in loco parentis can make certain decisions that we've agreed with you before you arrive.
Yes, that is actually a very, very good idea, because it beats purpose to say, my child normally goes to Nairobi Hospital when you're 50 kilometers away from Nairobi Hospital. And then you don't think about emergencies and all that. So when an emergency happens, the school will take them to the nearest facility, which may not even be accredited, but because there's no system in place that says this will go, this will not go, anything goes, you know.
Yeah. Anyway, let's get to your points.
So, okay, so the first one is what we've been talking about. So everybody needs to understand the health system in their children's school. The same way we go for PTA meetings and discuss marks from here to Never Never Land. Oh, they have failed, they have passed, I don't know what else. Can we add the health factor in there? Can we actively ask, how many kids fell sick? What was the emergency response? How did that happen? How can we improve it? And moving forward, so that it's not just one-sided all the time, marks, and diet. Food is good. I mean, I'm a foodie, but there are more things to life, you know, because all these meetings, these are the chances we get to be able to effect change.
Yes.
And if we don't talk about some things selectively, nobody is ever going to bring them on the table. So we need to purpose that the next meeting we go for, we're not only interested in what number our school was in KCPE and why the diet is Githeri and not Mandazi, but you know, what is the health system in place? Tell us. And what is the emergency and whatever referral system? I want to know. So that's the first tip. The second one, we need to intentionally have a good referral system in place, whether it's the school or you, the parent, but you have to meet somewhere in the middle, because the reality is that you know, as parents, you probably prefer some different kind of care for our kids, but when they're in school, they are under somebody else's care. So you need to either know what the referral system is or be able to provide a referral system for your child.
Yes.
Nothing stops you from saying, my child normally goes to Nairobi Hospital, so if they're sick, call this ambulance number and they will come for them and take them. That's fine, because that means you have already planned that out. But you can't just say, they will go to Karen Hospital and you're coming from Eastlands, and you don't say how they will go there.
Yes.
And then the third one, we all need to provide history. Oh my God, if I don't say this now, I don't know how often I will say it. Now more than ever, the school needs to know your medical history, your child's medical history. And yes, we have children who have diabetes, which we now know is not a good thing with COVID.
Yes.
I don't know when the last time you checked your child's sugar. So when you're going to check yours, please take your child with you.
Yes.
So we have issues of diabetes that are rising because we have more children who are obese.
Yes.
And that's something we need to talk about.
Yeah.
Yeah. So if your child, there's no history about your child's medical, medical history about your child in the school, imagine if there's an emergency and them knowing as simple as what is your child's blood group would have changed everything. I mean, God forbid, and I'm knocking on wood right now, we've heard of cases where children had an accident to the school bus.
Yes.
Some of them need blood transfusion. Is it at that point that they want to start testing blood and finding what your blood group is before they find blood? Imagine if all these things were in place, blood group, history, blood sugar, I don't know what, all those things. It makes care faster. So intentionally, when you go to whatever the school you take your child to, can you identify if they have a medical system in place? Because they need to have it, and all the children's history must be with the school. Because whether we like it or not, our kids spend most of their time in school. That is where the history should be. not with you in the car, I don't know where. So that's number 3. And number 4, health insurance, you have said it. Health insurance is important because we never know what is up ahead. Yes, I know it's expensive. I know most people have NHIF, but what the hospitals you've opted in for NHIF, where are they? Are they near your child's school? If not, where, you know, are there any others that are within the where your child's school is? Yes, the locality, are they within there? So that can be your step down before you refer. And then make sure that your insurance covers, or that you also address the issue of an ambulance, or how the child will get to the hospital. I think this one has the power of, I mean, the more you are, the more you can approach like an ambulance company or whatever, and get a good deal, you know, and say, you know, as parents from school A, we are looking for ambulance services for the event that our kids fall sick. Then they will say, okay, for ambulance, we charge this much. And because you are all these people, you have the power of give us a good price.
Yes.
You know, yeah, so if there's an insurance, the insurance needs to come probably with an ambulance option. If not, yeah, the same way you guys get school transport and all that, we can, I mean, we really need to have an ambulance in place, especially for the, I mean, like in Eastlands, when's the last time you saw an ambulance hanging around aimlessly?
No. You just
Yeah. So,
because in most cases, we should take personal responsibility. In most cases, we wait until someone is so bad, and then we don't know whether to call an ambulance, and the response times are appalling. There are countries out here where a response time of 5 minutes is bad. For us,
yes,
a 5-minute response time is amazing, and that's appalling. And I find that in most cases, if you live in Eastlands, you're better off calling your neighbor who has a car to get a relative to a hospital 5 minutes down the road than calling an ambulance and waiting. And again, this is why I say everyone needs to have basic first aid that is renewed every year.
Yes.
But please, comprehensive first aid that is renewed every 3 years. Because that could be the difference between you knowing what to do for somebody with a heart attack, for somebody who is diabetic, and they've gone hypo, or hyper, because we have to know the difference. One of them needs more sugar, one of them doesn't.
And you know, you think at this point, it looks funny. Like, I will tell you one thing. My mom was just telling us the other day, her mom was diabetic, and they didn't know. And when they went to hospital, so she went into a coma, and they rushed her to hospital. And because they had not done due diligence, and there wasn't history and all that, and she was in a coma, and the people there did not think to test her blood sugar, they gave her glucose. And that is how she just went. Yeah.
And that's the thing. And as you say, it's so sad that I feel that we value life so little. We don't value life. We value education. What is education without life? You see?
That's what they keep asking.
I saw someone yesterday posted on one of the social media platforms that, oh, I'm not well, and pray for me, blah, 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 blah. There was medication upon medication upon medication. And a quick check on some of the medication showed me that this is cholesterol lowering medication, high blood pressure medication. These are lifestyle problems that you see over the last 5 years. If you look at the same person's timeline, you see alcohol, you see meat, you see all these things. Do you see what I mean?
Yes.
Why should I pray for
you? You pray for me so that I can get, you know, some sort of sense so I can change my lifestyle?
I ask this. I'm not saying that I won't pray for that person, but why are you looking for sympathy when this is self-inflicted? And it's the same for us as parents. You take your child to a school, you don't ask, Kwanza, what is your procedure if my child was ill? Event, and in the unfortunate event, and in the event, yani tunaomba isifanyike. But ikishafanyika. Number one, how are you going to deal with it? How are you going to deal with your child? Mimi nishapelekwa hosi, nikalala hosi in boarding school, and I was taken back to school, and my parents never knew about it.
Imagine that. And we've had kids dying in school, you know, with all this nonsense about, I don't know, disclosure or non-disclosure. I really don't understand where people signed, you know, if my child is sick, just deal with it.
Yeah. And the thing is, it's okay to say, deal with it. You understand? In my son's old school, they had a full booklet. I think this thing was about 20 pages. Of, hey, this is our uniform. This is what we expect from you. If you don't wear, this is what will happen to you. This is our behavior thing. This is what we expect. Blah, 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 blah. Were you to be ill in school, this is what would happen. Even. Now, this is signed by both child and parent. At 11 years old, 12 years old. So it gives the child, it's two reasons. Number one, the child knows exactly what is expected of them, and they know exactly what to expect from the adults in their lives. If I was to be sick in school, my parents would be called, the school can take me to hospital, and these are things that you can talk to your child about and can reduce their anxiety. Teenagers and children in general are vulnerable. Everyone is vulnerable. But children especially are vulnerable because they're just, choices are made for them.
I know, and that's the sad part. The choices are constantly at home, someone makes the choice. At school, someone makes the choice. I'm not saying that you should let them make their own choices.
Oh.
I'm just saying they should be able to understand what the choice is.
And why?
Yeah. Yeah.
Pointing
okay, point number 5 is really about having that history. It's about having a booklet or a book or something that can, you know, if you don't want to give it to the school, let the child have it in their bag or something. But one that can be able to provide any medical information, the basic ones that are required in the event of an emergency again. Yeah, because we never really know what will happen.
That's it.
Things happen, and that's the sad part.
Have an accident between home and
yes.
And then suddenly anaokotwa na watu, hawajui jina yake, hawajui namba ya simu, hawajui chochote. When we were kids, they used to make us cram certain information. And in my family, we literally had written on paper, this child
Yes. It's important.
Buruburu phase 3, house number 10. It's true. We are 941. I still remember. You know.
Exactly.
So,
but now the only thing you have is probably a bag that's written the first name.
Yes.
I mean, that comes with its own risks as well. But then what else? What do you have in that bag that can contribute actively to save a situation when the situation presents itself, you know?
And especially with children who have underlying conditions. A lot of children, like my family, we have skin disorders and respiratory disorders. Yeah, this is our weakness from my mother's side. So,
Nitakusema.
she told me not to lie. So,
Uh-huh.
this is something that occurs in my family. So there's a family history of diabetes, skin disorders, and respiratory disorders. Now, things like diabetes can also affect other internal organs, you know?
Yes.
And right now that we know that there's a clear link between people with diabetes, yeah, and how they're affected by COVID. You see, we know to let everybody who is involved in your child's care, my child is diabetic.
Yes.
The whole school knows this child is diabetic.
But
Has a certain condition, whether it's epilepsy, whether it's diabetes, anything like that, there are bands that you can buy that have whatever it is, whether it's on the inside of it so that the child doesn't feel self-conscious. Yes, but medical professionals will know that this band for this color is for this thing, if your child should end up in a hospital. And for the ones that don't know, make it on the inside of this band, telephone number, conditions.
I like, yeah, I mean, that's very good info because it's easy and a band is, easy to carry around and all that.
Wear it.
Yeah. So what I was going to say is that is really good only if even you as a parent know what the underlying condition your child has.
Yes.
Because the reality is, as we speak,
yes,
most parents don't know what the parameters of their children are. Because for the simple reason, hajakuwa mgonjwa, sasa hiyo story mimi sijui.
And this is what we talked about the other day about having a GP, a general practitioner.
Yes.
And have a family doctor who you see at least once a year. And then you kumsalimie. Mpate hiyo familia yake. Ni familia. Watu waangaliwe. Watu waangaliwe general condition.
General condition. No, but honestly, yeah, because the reality is in the African setup, we don't normally go to visit the GP unless we are sick. And now we are not even going to the GP, we are going to some specialists.
Yeah.
So it's difficult at this point for someone, a parent, to sit comfortably and be saying, I know my child inside out. When is the last time you checked their blood sugar?
Yes.
Can you for real say your child is not suffering from any diabetic tendencies?
Yes.
And I'm not speaking to only the parents who have obese children, because I know someone is sitting somewhere thinking, mimi mtoto wangu si mnono, so hapo siko na hiyo shida. We all have that problem. Why? Our diet. Your child may have a very high metabolism, but the diet, if it is not a clean diet, we all at risk.
Yeah, and also what we have to remember, the thing that gets us pre-diabetic and diabetic is this thing nowadays where, number one, we consume way too much sugar because sugar is everything. And after this, people are scared. So najiuliza, hiki kitu ungeslice hivi na mweke ndani ya waru, mweke ndani ya fryer, ona, already it's fried, and then waongeze na kidogo it is poor, sio? Cereals. Cereals are so high in sugar, I don't know why parents are still giving their children cereal. Yeah? Cereal initially was a way of maybe making kids drink more milk, that's why I think the Americans started taking a lot of it. But now, if you go to the cereal aisle, when we were kids, we were on Weetabix, cornflakes, and maybe one other, morning noon or whatever it was. So, now it's aisles upon aisles of sugar. If it's not cereal, it's bread. Anyway, what happens with a high carbohydrate diet is it takes us up and down. So our bodies are constantly fighting to keep our insulin levels even. Our pancreas is constantly fighting to keep everything even. Our liver is constantly fighting. Our kidneys are constantly. Our bodies are at attack all the time from our diet.
Yes.
Which means we are more susceptible to all these other diseases that before were made or found mainly in older people. We are finding them in 11 and 12-year-olds, unfortunately. And they might not
Yeah. Exactly. So it makes sense that before, I mean, it would be a very intentionally smart thing to do if before you took your child back to school,
yes,
you went to your general practitioner,
yes,
opened a file, get a wellness check, and be confident about it and say, okay, this is done. Get all the history around your child. So when you go to school, you're not just handing over the child, the bag, meet the teacher. Hand over some history. Let them understand what the child, the needs of the child are health-wise, so that when something happens, the child will be helped in a smart way. Isikwe, kujaribu, jaribu hii, oh, jaribu, unaona? Yeah.
And also what we have to do as parents, and as parents, I wouldn't say as mothers, as parents, we have these children from birth. There are certain things that happen at birth that can affect people long term. My son was a forceps delivery. Now, a forceps delivery comes with its own ninis, underlying things later on in life. They've been linked with people having poor short-term memory. Now, someone is telling my child they're stupid. My child is not stupid. My child has a problem with short-term memory because of how they were birthed.
Yes.
Yes? My child has a problem with their retention of information because of how they were socialized at 2, 3, 4 years old. The school doesn't know this. My child, it's like judging, what did Einstein say? Judging a fish by its ability to climb a tree.
I know.
It's like thinking they're stupid. But what they're supposed to be doing is swimming. And when we talk about medical history, it's not just the physical history that we can see. It's the things that make it harder for our children to actually learn.
Yeah.
And these things can affect our children to the point where your child is so stressed that now they're constantly ill. Psychosomatic illnesses. But how do we work with the school? I know like now we're talking about emergency type situations, but how do we mitigate against those things that our children have to live with day in, day out, that are not physically visible to other people, that the teachers might not be aware of, that we ourselves might not be aware of, but for the fact that we take our children for regular checkups?
Yes, so actually you're right. What you've talked about today, the most of it is just school health services, not the school health program, because those are different. The school health services just deals with emergencies, the medical, physical things that happen on the go. So a school health program actually has almost 8 components. There's issues around the school environment. How is the environment? How is the grass too long? Is it too short? The toilets, everything, all that is part of. Yes. And then you have health education. Are the children taught some health education? And I'm not talking about the one that comes in science. Hiyo iko kwa syllabus, kuna ingine. Yes, that they should be getting. So you should be able to get, when you go to the school, they should be able to tell you, in our school health program this year, health education will be focused on whatever, they'll pick a theme, and that's what will run the whole year or the whole term. But if that is not being mentioned, then that's an issue. Number 3, you need to have guidance and counseling within the school. Yes, and that one does not include ile inafanywa na secretary. Wewe unashindanga umechelewa utaona. That is not guidance and counseling. So there needs to be a safe place that the children can go and be able to talk out what the issues are. That goes hand in hand with mental health, because that is also another component. And what we have in schools right now is the school teacher is also the class teacher is also the counselor. You're my class teacher. Already you intimidate me in one way or the other. What are the odds that I'll come to you with my problems? Akuna, do you know if your school has a guidance and counseling program? Does it have a focal person? And do your children access those services? Because those are the issues you also need to look at. Because the reality is right now, there's a lot of dysfunction in families, a lot. And whether we like it or not, we need to talk about it. Most parents are not together. Well, not most, but we have parents who are living separately.
And those are of married people. We're not, many children now, a lot more children than statistically written down are growing up in single parent families. You know?
Yes.
6% of marriages end in divorce.
Mm-hmm.
So to say, maybe about 70% of children are growing up in single parent families. To say it
exactly. And we are assuming that they are okay. There's nobody they ever get to sit and talk with. And it can't be my class teacher who is already on my case for one thing or the other, you know? So a guidance and counseling program needs to be in place. A mental health program needs to be in place. School food and nutrition, that one we are very good at. We go to complain. Kwa nini wanakula githeri 3 times a week? Wangekuwa wanakula sausage na mandazi. Aya. Now we understand the high carbohydrate business you were talking about.
Yes.
And then health promotion. I know this one happens somehow, but normally sponsored by people who are trying to sell a product. So your kids will come home and say, leo watu wa Protex walikuwa wamekuja. Leo watu wa Dettol walikuja. Okay, all that happens, but because of external sponsors, not within the school control. So the school needs to have a health promotion program that's running.
Yes.
And then the last thing is how the school integrates with the community. Because the school is within a community. It's not just hanging. And it's good health for them to find a way to integrate to the community, because everything that happens within the community will somehow go into the school. For example, if the community is suffering from cholera and you, the school, you're folding your hands thinking, hey, hawa watu wako na mashida, hiyo cholera itaingia tu hapo shule, because half the, exactly. So you have to figure out how are you proactively working with the community around you. So the school health program is really rich, really, really rich. And it's supposed to be a document. It's not word of mouth. It's supposed to be a written document that you, the parent, has. So if you don't have it, one of the things you're going to ask the school, other than that notorious school fee structure, is help me with your school health program. I want to see. Yes, because they should have it. And they should be able to tell you this year, these are our activities around the school health program. The emergency and referral system and all that, that is just one component. School health services, yes.
How common is it in Kenya to have that? You see that?
No, I know it's not common, but guess what? And I was telling you, which I'll also say here, yesterday I saw a comment again on social media about some lady who went to a hospital and she didn't like the service.
Yes. But
she sat through it and left there and angry, and then went to social media to complain. Now, healthcare service is supposed to be two-way. The health workers and you, the patient, or the service, the person who's seeking the service. The same way with the school. if we don't ask for these things, how do you suppose they will feel like it's necessary so that they can put it in place? The next time, I mean, that's how schools now end up having swimming pool, sijui nini, because parents are saying, if you don't have it, we're removing our children from here.
Yes.
And because that's a business, especially for private schools, I know.
Yeah. Because we don't just bring our children to schools to be taught information that in 10 years' time will be irrelevant. There are softer skills that children need to learn while in school. They're in school for the vast majority of the day, for the vast majority of the year, for a good chunk of their childhood. Say about 13 years?
Yeah. Actually, yeah.
Depending on where you are in the world, and in some places even 15 years, depending on when you took them to nursery and when they started putting information into their heads and what kind of information, you know. So obviously, as parents, we are demanding all these things, but I think that we need to be more involved. If there's a PTA meeting, go in with a structure of what you want to find out. Go in with solutions as well. Don't just complain. You know what I mean?
Yes.
What are Irene Ogong'o's programs? 5 questions.
And for every school, I can guarantee you that every school has parents who work in hospitals, has parents who are accountants, has parents who are. What percentage of your expertise are you providing to the school your child is going to, so that you can go and complain about what you find on the ground? Did you offer your service there?
That's what I'm saying. I like solution-based problems. Kuja na shida. Tuambie. I have seen a gap in our school. Our school, I've looked at the health system, the school health system, our school health program. I have spoken to our expert, Irene Ogong'o of Patient Support Services Africa, Nurses in Africa. I have spoken to her. I have presented her with this document. She has told me this is where the holes are. I propose that from the information gathered from her and from other sources post speaking to her, I propose that we move forward by, number one, working with the school to write a better program, because now we've been given a better template. B, finding a local doctor or nurse who will maybe not be permanently based here, but once a week can come and see this class, this class, this class. At the end of 12 weeks, tumemaliza kila mtu, tena tunaanza. So every time, by a doctor or a nurse, whether they have a GP at home or not, just for vital statistics, so that we know our children are well. That will have a two-pronged effect. Number one, you know that you have a healthy community. Number two, you avoid unnecessary absenteeism, because children are not constantly now being ill. If they find a child with cholera, it's treated before it spreads. If they find a child with any contagious thing, it's treated before it spreads, because that negligence. You know what I mean? So we've agreed. Number two, we don't have a system where we know how emergencies are dealt. Basically, you as an informed parent inform other parents. Guys, this school is wasting a lot of money on electricity. That every year we have a 10K new spending. We, and over the next 12 years, make sure that this school never has to take power from Kenya Power and Lightning again. I call them lightning because that is what they do. They lighten us.
We are very together.
You know. So again, it's that thing that we always speak about, Irene. Self-responsibility. You know, what are you responsibility for you as a parent? You've listened to this program. As a person who has a child in their lives, you've listened to this program. What are you going to do personally to take personal responsibility for one thing, for one person, because it starts with you, for one thing.
Just one.
What document kako? Uliza hiyo swali moja, because that will then start a cascade. If not, kama wewe uliza, share this program with somebody who you know is in your PTA, is a teacher at the school, any of that. Just share it. Start that snowball effect, and let's help each other grow as a community. Senior.
Yes.
Yeah. Mimi naona tuke. I'm saying that I think our
Yeah.
work is over.
Yes, it's over. I mean, there's nothing else we can say that we haven't said.
Yeah.
And you have, I mean, yeah, as if we want to change, if we want change, we must be part of it. It's not that things for who wants change? Who wants to change? It doesn't work that way. You can't want change and not want to change.
Yeah.
So, you know, we have to meet it.
We have to make the change we want to see in this world.
So yeah.
I see as if Irene amekwama hapo kidogo. But anyway, guys, thank you so much for joining us today again on this really.
I'm not sure what happened, but yeah.
I was just saying thank you so much to our viewers for joining us today. This is a very important thing that affects our next generation and the generation. So thank you to everyone so much when they keep supporting us by watching, by sharing, by doing something in their community to make that change that needs to keep happening. Asanteni.
Thank you.